Everybody. So for this video, I would like to discuss OCD, otherwise known as Obsessive Compulsive Disorder. Typically, people use that term very loosely, or they use that acronym very loosely. They'll say, oh my god, I'm OCD, just because they simply are cleaning something, or they prefer things a certain way, and in a very minor sense. But what they don't realize when they use that term is that that word and that exact disorder does have a lot of weight to it, especially for those who are diagnosed with it. It is far beyond just simply wanting to make sure there are no dishes on the sink. It goes beyond needing to wash your hands. It goes past that realm of just simple manners that people need day in and day out. It interferes with the individual's life. And I'm going to go into that right now. But first off, I would like to introduce the fact that obsessive compulsive disorder actually stems from that generalized spectrum of anxiety disorders. So it might be a surprising fact to many of you that OCD is actually a subcategory and a type of anxiety disorder that people can experience, given the fact that the reason why an individual has these manifestations within their obsessions, which is what the O stands for, obsession. So it will happen with obsessive thoughts and such. And then C, and it stands for compulsions. So it has to do with the behavior within it. And those two things get triggered within stressful situations, which is a huge operational term whenever it comes to anxiety, right? Anxiety has a lot to do with stress. So therefore, whenever somebody is under high stress, many react with either a panic attack or they react with depression. But in this case, they'll react by doing overt behaviors that are repetitive. And basically, the whole definition of obsessive compulsive disorder sums it up. It's a type of anxiety causing the sufferer to experience repeated, unwanted thoughts / compulsion behaviors, and it's seemingly impossible to control. So it'll be as if a bigger force is taking over you, or as if you cannot stop because something bad will happen if you don't carry on with that ritual. So the thoughts are what the obsessions are. Obsessions can be summarized and simplified into thoughts, and the compulsions can be simplified by behaviors. Now, statistically, females are more prominent to experience this than males, and it affects a very small number of the population, though. It affects 1 to 2% of the population, and the majority of those diagnosed with it are young adults. And there are 4 main categories within obsessive compulsive disorder. And these are very common. I'm pretty sure then you'll understand a little bit more of how severe it can be. So the first category is counting. I don't know if you noticed, if you've ever seen somebody who has obsessive compulsive disorder, they literally need to do a specific task that eases that stress a certain number of times. So for example, somebody who needs to open and close the door 3 times before they exit out of their building, their home, their car, whatever it may be. That's an example of the counting manifestation. And then there's checking. Somebody who religiously, to put it into terms, that religiously needs to constantly check rounds on everything, and they need to constantly make sure that this is locked, that this is closed. And I don't mean in the sense where you're double checking. Double checking is a very typical form of being cautious and checking, but in this sense, it'll be a need to check over and over and over and over again, and it's caused by those obsessive thoughts that are penetrating through your brain and your psyche. And therefore, the individual experiencing all of those obsessive thoughts and intrusive thoughts needs to constantly check, because I'll go further into depth with that right now, and then it'll click. But it has to do a lot with some intrusive thoughts that cause a person to be paranoid, hence anxious and stressed. The third category of it is cleaning. So yes, some people say, oh my god, I'm OCD, all because they're cleaning the countertop and they don't want a single spot in it or whatever it may be. But the cleaning with the specific disorder reaches another level where this person needs to make sure it is spotless. And not in the sense where it's like, I'm being very thorough with my cleaning. No, in the sense where a person will clean over and over and over and over and over again until they feel that exasperated, for example, germs are gone, or microbials or bacteria, because a part of those obsessive thoughts, and the most common form of it, which I'll go into right now, has to do with a lot of cleaning and germophobia. It goes hand in hand. So this individual, it won't even be something that's visible to the naked eye. It'll be a perceived flaw that they need to clean within a surface or within a living space. And the fourth main category is avoidance. So this one is a little less common. It's a little bit harder to pinpoint and view in somebody, but it'll be basically avoidance because it's those intrusive thoughts again, or those compulsions again that take over the individual. But that can be a little bit more confused, and the lines will be a little bit more blurred with someone who has agoraphobia and social anxiety. So while somebody may be avoiding situations or circumstances, it can be a little bit blurred within phobias and social anxieties, because people may just think, okay, this person just has this, but it could be possible that that individual realistically is just having a very rare type of OCD. So there are actually a couple of possible causes as to why OCD manifests in certain individuals. So the first one is obviously genetics. It can very much happen with people, and interestingly enough, a form of OCD and a form of a compulsion that may happen is actually Tourette syndrome. Tourette syndrome is also another thing that's a little bit downplayed, where people just think it's somebody just cussing out of the blue. But Tourette syndrome actually has so much more to it. It has a lot to do with an individual having tics. It's not just vocal tics, but it can be just body movement tics. And that has to do a lot with that repetition, that over and over and over again cycle and loop that the person gets stuck in. And that one's a little bit more unconscious though. It's not necessarily a voluntary behavior. It's a little bit more involuntary. So someone will have a tic, like in their neck, for example, or a vocal tic, and it's a little less categorized along with the counting, checking, cleaning, and avoidance. It'll be a little bit more of something that just kind of like a burst of energy that comes out in it. So that's a little bit more of an involuntary form of symptoms that can occur with OCD. And for children, it can begin as early as childhood. So you'll see that happen a lot, and it occurs and it can be spotted by a single gene mutation. So that's when it stems into the genetic spectrum. Another cause of it can be brain damage. So basically, this central part of your brain called your basal ganglia will get affected, or there's a little bit of a deterioration in it or an abnormality within it. Also, your prefrontal cortex, which I have gone over, is a part that has to do with judgment and impulse control. So sometimes that can be a little bit damaged or underdeveloped, or maybe there's not enough significant blood flow going through there, or neurotransmitter activity that goes through there. And there are a couple of other parts of your brain, like the choreas, the Huntington's one, and I believe it starts with an S. But they both go hand in hand, and it's a chorea regions within the brain, and that's CHOREA. But those are a little bit harder to pinpoint than the bigger regions of the brain, like the basal ganglia and the prefrontal cortex, to assess any sort of damage that may have been there. And the most effective thing that actually helps with that is the fact that, a lot of medications and drugs can alter the behavior. So, of course, prescription drugs in this case, where it'll increase the frontal lobe activity. So, for example, if it has to do with the prefrontal cortex area, that frontal lobe will need to have some sort of increased flow and activity in there. And it usually helps a lot for them to have behavioral therapy, which again stems back to the whole behavioral therapy spectrum, where the person needs to address their cognitions, such as those intrusive thoughts, their behaviors, which are their compulsions, and then therefore be able to assess whether or not these things are linked, whether these things are rational, whether these things are purposeful in one's life. And there are a couple of specific prescription drugs that can work with that, and I'll go over them right now. The most effective medications for OCD are also linked to being antidepressants, ironically enough. So there will be, I have it written over here, clomipramine, fluoxetine, and fluvoxamine. I didn't want to get them wrong, but those three are also antidepressants, and those three have been proven effective in many patients that experience obsessive compulsive disorder. And a couple other treatments of it are SSRIs, which are selective 5-HT uptake inhibitors. So that also helps a lot with depression. Ironically, those parts of the brain are affected by both depressed patients or people, and on top of all, it's also affected by those with OCD. So selective serotonin reuptake inhibitors are the ones that actually can help with OCD, because the serotonin inhibits that sort of species typical behavior, because another theory of it has to do with a lot with the fact that these little tics and behaviors are from our prehistoric times. So a lot of researchers have theorized that this disorder has a lot to do with the fact that throughout evolution within our species, sometimes back then, our brains were a little bit more wired to be grooming each other. So I don't know if you ever see primates that groom each other, they groom bugs off of each other. We were not that far from that back then. So therefore, a lot of scientists have actually come up with a theory that they believe that some brains just haven't evolved as much, or they haven't let go of that disadvantage of a brain function. So therefore, it just gets carried in within the gene spectrum, and it causes the people to have those same primitive, so to speak, behaviors and compulsives to like start picking at things. So for example, that'll be linked to helping that serotonin reuptake, because they believe that whenever it comes to those OCD symptoms that are specifically like hair pulling, there's people that hair pull, that nail bites, that pick at their skin and such. So whenever it comes into those sort of behaviors and those compulsions, that can definitely help in order to prevent that occurrence from happening. Now, whenever it comes to specific other symptoms of OCD, I would like to go over a few examples to elaborate a little bit more of what it can be. So while people do, and like I said before, use that term very loosely, it actually has a lot to do with the fact that these thoughts and these behaviors can disrupt a person's life. So the only reason why it becomes a problem is because it becomes a sort of ritualized thing that this individual needs to do in order to address any sort of psychological stress that they're experiencing. And sometimes these needless behaviors, so to speak, are a little bit intrusive, and they can take the individual away from functions and responsibilities. So they inhibit a person's life. They become a problem because they are getting in the way of this person living their life. So it's very important for you or whoever you know that has OCD to address these issues, to go to therapy, to consider medication in order to correct these behaviors, so that way they don't get in the way of your life or manifest in another form that could be potentially dangerous for you. Because sometimes if it's counting, for example, you don't want somebody to be caught having to do a certain ritual in a dangerous situation that calls for this person to need to get out or get away from that. So it's very important to make sure that these behaviors are corrected, because you never know when the proper response is desperately needed in a situation, or just a proper day-to-day life for the individual and their well-being is necessary, and these things constantly make their way through. Now, I have a chart in a textbook that I like to refer back to a lot, so I want to make sure I get the statistics right here. So with a thought or behavior, for example, like the obsessions, which are the repetitive thoughts, I'm going to go over the percentage reporting symptoms, because I would like to elaborate a little bit more on the commonness of certain symptoms. So for example, concern with dirt, germs, or toxins is definitely the most common obsessive thought that goes through an individual, and that is about 40% of all OCD cases have a lot to do with cleanliness, dirt, germs, and toxins. They're referred back to that, so that's why cleaning would probably be the most common one, and I think that's why that stigma and that loosely used way of saying OCD came up, which I mean is understandable, but if we talk about this, then it's no longer stigmatized and it's no longer used inappropriately whenever it's insensitive to somebody who actually has OCD. The second kind of category of the obsessions affects about 24% of cases, and that's something terrible happening. Whether you believe it or not, and that goes back to that theory that I was just talking about, how this person or any group of people that experience it need to do these ritualistic things to help them out with the stressors because of the fact that their thoughts are constantly flooding in with them with stressful things. So that's where I was saying that it's really linked to anxiety, and that's how it's specifically in an anxiety induced situation, or even a link to that whole social anxiety situation, or with avoidance, like that one category within it. Avoidance is a little bit harder to pinpoint, but this ties in perfectly with this type of case because this happens when the intrusive thoughts are playing over and over again, and it is playing really scary scenarios, like extremely scary scenarios that are literally life or death. And therefore, that person will become a little bit reclusive because these thoughts are flooding them, and they will avoid things. That'll be their go to, that'll be their stress response, as a matter of fact. And 17% of cases have to do with symmetry, order, and exactness. So that's another way that it's been a little bit stigmatized, where things are not aligned or they're not symmetrical or the pattern is not consistent enough. While that may bother some, whenever it comes to an individual with OCD, this will cause severe psychological distress in them. It won't just be a little bit like, oh, that doesn't look right, or it's kind of bothering me. No, it'll be to the extent where it causes the individual with OCD severe stress, severe psychological torment, because it is conflicting with their obsessive thoughts and compulsions. Whenever it comes to the compulsions, 85% of cases are excessive hand washing, bathing, toothbrushing, or grooming. So that does coincide with the fact that there is a very big obsession with germs. So I think that is the most common one, and that is also linked to that theory that scientists came up with, that it may have to do with this excessive grooming habit that we have carried on, and maybe it didn't evolve in our brain or in our psyche, and therefore that individual is experiencing this obsessive and compulsory sort of grooming lifestyle. 51% of reported symptoms are also repeating rituals, so the whole in and out of the door, up and down from the chair, the whole sitting over and over again, opening the door over and over again, turning on light switches over and over again. That goes hand in hand with counting, and it is definitely pretty common. It's a little bit more common than people may think, and I think that's one of the easiest signs to detect in somebody. And checking doors, locks, appliances, car, brake, homework, that's about 46% of case symptoms. So that one coincides with that main category subtitle, I'm so sorry, subcategory that I just discussed. So that'll have a lot to do with the checking, the thoughts that go through your head, and typically they follow along with thoughts where that person's like, are you sure you checked it? Are you sure you locked it? Are you sure? Are you absolutely sure? Are you absolutely sure? And they have to go check, and you realize that they did it, but then again, they're like, wait, did you check that time? Were you actually present when you were there? So it's not far-fetched for us to be able to link this. Like I said, it has to do with anxiety. Obsessive Compulsive Disorder is a big kind of Venn diagram overlap with anxiety disorders, and it coincides when you really think about it. Anxiety is caused by severe stress, and it's a lot of projecting of thoughts and a lot of overflow of thoughts. So obsessive compulsive disorder is basically what happens when a person ruminates in those thoughts constantly, and in order to cope with those stressful thoughts and beliefs, they have to do a certain behavior that soothes that, if that makes sense. So the compulsions come in to soothe the obsessions, to kind of put the pacifier on the crying baby. So that's how that whole cycle and that whole loop of behavior gets created, and a person cannot necessarily get out. It's a coping mechanism gone wrong. It's a coping mechanism gone into an addictive way, got into an addictive pattern. So I hope that helps put OCD in a better light rather than just people using the term loosely to just describe it as somebody who's just very clean or somebody who just likes certain patterns. In order to do this, we need to talk about this so that way there isn't a stigma towards a category, and that way a lot of people that do truly experience OCD and how intrusive it can be and how much it can interfere with their lives, they won't feel so marginalized and ostracized whenever people just use a term out of humor or out of an inflation of a description of what they're doing. So please pay it forward, pass it forward, and educate each other over these matters, because you never know who you may be affecting or how sensitive these topics can be to individuals who are not yet ready to feel safe enough to talk about this. It starts until we start talking about it and start normalizing it, so that way this gets out of the shadows and people can find better ways of coping and better ways of dealing with their disorders. Thank you very much for watching, and have a great mental health day. Bye.